Hello everyone, welcome to our Latin lecture. Today we're going to be discussing the applications of computer science in medicine. I'm Connie.
I'm Ayushi.
And I'm Trisha. The integration of computer science in medicine has revolutionized patient care, diagnostics, treatments, and surgery.
In this lecture, we'll explore key areas where computer science and AI are impacting the medical field.
Machine learning models are really great at analyzing vast amounts of data from various sources, such as medical images, genomic sequences, and clinical records. These datasets often include different variations of tumors, from benign to malignant, allowing the model to learn to recognize and distinguish between what are normal and abnormal patterns. Machine learning models used in cancer diagnosis are supervised learning models, meaning they learn from labeled or annotated datasets, where each image is paired with a known diagnosis. This means that as the model is exposed to more data, it becomes more and more accurate. This is vital in the diagnosis of diseases or cancers, where early and precise detection could significantly improve outcomes. Here is a simple explanation of how a supervised learning algorithm might work. It takes a selection of data of different shapes, labeled to say what they are. For example, a circle is a circle, and the model learns from this in order to make accurate predictions and correctly identify shapes in the future. Breast cancer is a type of cancer that starts in the breast tissue and affects about 10% of women at different stages of their lives. Despite many advances in the early diagnosis and appropriate treatment of breast cancer, the mortality rate of it is still high. However, with the development of diagnostic methods, the early detection of breast cancer is more possible. With the detection of tumors in the early stages, a significant reduction in breast cancer mortality has been seen in the recent few years.
Another sector of medicine that uses computing is in treatment. In recent years, AI has been used as a tool for genomic data analysis, providing personalized medicine tailored to a patient's genetic makeup. Furthermore, wearables and IoT devices are used to monitor real-time health data, such as heart rate, glucose levels, or blood pressure, and send it to healthcare providers for monitoring and timely interventions. AI has the potential to derive a meaningful relationship within raw data sheets of patient history, lifestyle, gene expression, and more, which can be used in the diagnosis and treatment of a disease. The way this is usually done is using neural networks, which are based on the biological nervous system. A neural network is a group of interconnected computer processors called neurons, which perform parallel computations for data processing. Here is a simple structure of a single biological and artificial neuron, both taking an input and release an output. In the artificial neuron, it performs a mathematical function on the input data in order to determine the output. Here is another photo example showing the kinds of data that would be put into a data set, processed, and then analyzed to create personalized medication. Smart wearables also generate a plethora of data through various sensors and detection algorithms. These are not just used in strictly medical devices, but ones that everyday people may use, such as Apple Watches or Fitbits. Atrial fibrillation is a heart condition that causes an irregular and often abnormally fast heart rate. It has a high risk for stroke and heart failure, which in some cases can be fatal. In 2017, a study was launched, sponsored by Apple, to determine whether a mobile app that uses data from a heart rate pulse sensor on the Apple Watch can identify AF. It is the largest remotely conducted study to date, with over 400,000 participants across the USA over 8 months. The algorithm scanned for pulse irregularities to see if the heart rhythm was suggestive of AF. If an irregular heart rhythm was identified, the participant received a notification on the Apple Watch and was given a telehealth consultation with a doctor and an ECG patch for further monitoring. The algorithm proved to be largely successful, with a positive predicted value for AF of 84%.
Another industry in medicine where computers play a part in is surgery. Surgical robots have grown to be more famous in the modern day. Surgeons can use a robotic device to do a procedure on a patient, which includes the device having a robotic arm that can hold small surgical instruments. The surgeon can then move the robotic arm using controllers and a viewing screen. Due to this, robotic surgery can be done through extremely tiny openings in the skin or other tissues, this approach being called minimally invasive surgery. Therefore, robots help surgeons perform delicate jobs which human hands may not be able to do. As well as just robots, AI imaging can also be used in surgery. AI imaging refers to an image created by AI algorithms based on the patient's data. As shown in this image, a surgeon has used AI imaging to create an image of a patient's tumour, highlighting parts of the body which are at high risk using different colours. This is an extremely useful technique as it can help surgeons make better and more accurate decisions, such as allowing surgeons to target fixed areas. Job replacement is only one ethical issue that many people discuss nowadays, as there are still many ethical issues occurring in the modern day. The first one being responsibility and liability. This refers to people being confused whether the surgeon or the robot is to blame if something goes wrong during a procedure. The second ethical issue is training and expertise. As robotic surgery is being used more often, surgeons can become reliant on these robots, and their manual skills may be forgotten over time. This can affect their ability to perform traditional surgery in cases where robots cannot be used in the future. Lastly, the third issue is cost and accessibility, which can also lead to only wealthier patients being able to access these advanced procedures, causing unfairness. Robotic-assisted surgery with the Da Vinci surgical system gives a surgeon an advanced set of instruments to use in performing minimally invasive surgery with high precision and accuracy. This system is a robotic platform designed to expand the capabilities of a surgeon's eyes or hands. The procedure works by a surgeon sitting at the Da Vinci system console. The Da Vinci Vision system then gives 3D views that is magnified 10 times to what the human eyes see. Lastly, the tiny instruments that a surgeon uses have a far greater range of motion, helping a surgeon move each instrument with smooth precision. As you can see in these images, the picture on the left shows the Da Vinci system console with the surgeon sitting at the vision system, and then the picture on the right shows the small surgical instruments that a surgeon uses when performing the procedure. Thank you so much for listening to our lecture. Hopefully you have a better understanding on how computers specifically, are used in medicine. Thank you for listening. We'll see you next time.
Thank you for listening.